I have absolutely no idea. But me in front of a bunch of people, I'm very comfortable with that. Good? Okay, well, thank you so much for coming on this cold, windy evening and for leaving your comfy, cozy abodes. I'm going to keep my jacket on and stay warm, and I'm glad you guys are too. And it's really pertinent right now, talking about flu season readiness. For those of us that have had the flu, loved ones have had the flu, it's great to know what to do about it, both preventatively and as a natural course of treatment to help boost your immune system. So that's what we're going to be talking about, best ways to prevent and recover quickly. So I always like to start out with a bit of who I am, why am I here, why am I talking to you today? So Regenerate Health, we really seek to empower our patients through education to be able to get the health they want without drugs or surgery. So that pertains to the flu. When you get the flu, getting over the flu, staying healthy with the flu, not having to use drugs or surgery because most things can be treated naturally. We really like to investigate the causes and figure out really what each individual body needs, knowing that whenever there is a sickness, whenever there is a health issue, whenever there's a deviance from feeling well, the body's simply not getting what it needs in order to heal itself. So each body is different. And really, I take a very Waldorf approach to medical treatment. So I'm really grateful for the Waldorf School for sponsoring and putting on this event this evening. I myself went through almost every year of school at a Waldorf school, either here in Santa Barbara, in France, or in New Hampshire, where I finished out high school. So I'm a very, very strong proponent of the Waldorf approach. It really speaks to me personally, and then it's a philosophy that I've carried over into my professional life, in that really treating our bodies individually, treating not only the body but also the mind, and really the goal being to develop health freedom, a place where you feel empowered with your health and then can go out into the world and do what you love best. So getting back to the flu, just a little sort of understanding of what is the flu. Technically, it is an acute viral respiratory illness involving influenza A virus. Now, as we were talking about earlier, people use the term flu rather fluidly, and a lot of times it can be due to another virus. So rhinovirus, echovirus, there are a lot of viruses that can have flu-like symptoms. Also, a lot of bacterial infections can be misdiagnosed as the flu. So I do see a lot of patients that have the flu and were thought to have had a bacterial infection and given antibiotics. From a treatment side, it's much easier to give an antibiotic to a patient than say, hey, there's not really much we can do, and have them leave the office. So I see a lot of that happening. Really, signs and symptoms are not specific to the flu. They can be a lot of overlap with other things, but really the onset for the flu is usually pretty abrupt. Headache, maybe fever, muscle aches, that is something that's pretty characteristic of the flu. Respiratory illness, weakness, fatigue, and really something that's characterized the flu this year is a decent length of sickness. People are used to a cold, something minor resolving in 3, maybe 7 days. It really persists 10, maybe 14 days. So I've had a lot of people pretty concerned, hey, what's going on? I've had this for 10 days now. Shouldn't I be getting better? So we're going to talk about that. So the flu, so what does it mean if you get the symptoms of the flu? In our society, becoming symptomatic, getting a fever, having a headache, being fatigued are thought of as bad symptoms, but really it's the immune system being able to mount a response. So that's actually a good thing. So there's a difference between a weakened body that then mounts symptoms and is susceptible to a disease versus a weakened body that isn't even able to mount symptoms. The latter would actually be a little bit worse because the body can't actually clear out whatever it's exposed to. So having symptoms is not always bad, and particularly a fever. How many people do you know that are really concerned if they have a fever? If they have a fever, it means like it's a significant sickness. They really have to do something about it. Some people take Tylenol to suppress the fever. It's scary for parents, particularly with kids, but it's not something that's really celebrated. And I really do celebrate fevers in my practice as long as they're up to 104 degrees, definitely not higher than that, but it means your immune system is really trying to kill off whatever pathogen is inside your body. So that's really important to let it run its course. You can also induce a fever. So a hot bath is a really good thing to do with some hot tea, monitoring your temperature, and then going to bed, for example. That can be an effective way to give your immune system that extra boost to really help clear things out. Something that I get asked a lot, particularly this year, is why this year are we seeing a higher incidence of the flu? So I'm going to talk a little bit about germ theory versus, our system as host bodies and why we get the flu. But really this year, there's been a lot of increased stress in our community from the natural disasters, from toxin exposures, from a lot of fear, a lot of uncertainty. All of those are going to weaken your immune system. And this year's virus has been a little stronger, a little more virulent. So all those factors coming together have made it a little bit worse. So why is the flu concerning? Some people think that it is, a major illness that we absolutely cannot have. Other people think, my body can get through it. Really, it all depends on what you have going on, what risk factors you have, what age group you are. So for most people, they can recover without any complications. Yes, they're going to be down for 10, maybe 14 days in a longer course of the flu, but our bodies are designed to heal it. And what we'll talk about coming up is some ways to boost your body's ability to handle the flu. But there are certain groups of people that are a little bit higher risk. So infants, elderly, debilitated patients, those with heart disease, pregnant women in their third trimester might need a little bit more monitoring, a little bit more support to make sure that they're safe. Because some complications can involve pneumonia, bronchitis, encephalitis. So it's something not to be taken too lightly, but to be appropriately monitored. So a common question also is, why do I get the flu? Why did you get the flu last year but not this year? What's different? So there's really sort of two opposing and yet overlapping reasons. One has to do with exposure. So germ theory. In 1860, there were a few doctors that came up with the notion of exposure. It is the pathogen that causes this disease. When you're exposed to it, it takes hold of your immune system, and that's the cause. Now, that only partially explains it, because think about people that have had exposures. Say you're on an airplane and someone on the airplane has the flu. Not everybody on the airplane is necessarily going to get the flu, although they're all breathing the same recycled air, so that kind of only partially answers the question. The other component is the health and the internal environment of our bodies, both the health of our immune systems and every other stress, every other burden that our body's having to deal with at that time. So that goes really to our internal environment and how susceptible you are to that pathogen taking hold of your body and essentially, multiplying so that it really becomes something your body has to fight. So that underlying susceptibility is what allows the virus to thrive. And that susceptibility really comes from nutrient deficiencies, inflammatory foods, toxins, other burdens on a weakened body that can be, again, what we've experienced in our community: smoke, toxic mold, fear, uncertainty. All those stressors really do wear us down, and those are part of what are involved in making us more susceptible. So it may be a college student that was really healthy, hasn't had the flu before, and then they're really stressed out, their nutrition's not as great because they're not at home. Boom, voila, this year they get the flu. There always have to be reasons why the body breaks down and you get the flu one year versus another year not. So we were talking about having the flu. So what are some things that you can do to prevent the flu? So going back to what I said at the beginning, the body functions well when it gets what it needs. When it doesn't, There's simply physiology. There's cause and effect. If your body is lacking certain key nutrients, say you're deficient in B vitamins, potentially vitamin D, maybe vitamin C, whether from, poor inadequate nutrition or some other disease process that is burning through your nutrients, or some environmental exposure that's again burning through your nutrients, the cause and effect is without an adequate nutrient supply, your immune system can't fight as effectively, so you're going to be more susceptible. So I love physiology because it's a set of laws that have known consequences so long as we understand what the step of events are. So knowing that, there are a lot of things we can do to support our bodies from a preventative way, essentially giving the body what it needs plus some. So we all know about the amazing properties of sleep and how 8 hours minimum is really what we need. I don't know about you guys, but myself, if I get less than 8 hours, 2-3 days in a row consistently, I start to feel it. My brain is just not as clear. I might be a little more moody. I just have a few warning signs saying, you know what, you're pushing a little bit too hard. You need to be careful. Otherwise, you're probably going to get run down and you're going to get sick. So I have the blessing and the curse of a system that really keeps me in check. Not everybody is as sensitive, but physiology is physiology. If you get worn down, your immune system is just not going to be as strong. The second thing is nutrient-rich foods. So we all know the power into our body is really the quality of how our body can function. So I know we have some great quality snacks here tonight, and I know as a community you guys take a big emphasis on nutrition, which is absolutely foundational. So, getting those extra antioxidant-rich foods, bone broths that have a lot of key minerals and nutrients and are really easily digestible and absorbable. The next thing is sun exposure. So on a day like today, most of us probably didn't get very much sun because it was on the colder side. So we can always use vitamin D as well. Most of my patients, including myself, need to be on vitamin D, even though we live in a city that has the vast majority of sunny days year round. Most of our lifestyles are still not allowing us to be outside for at least 30 minutes a day at high noon for us to synthesize the amount of vitamin D we need to help boost our immune system. So getting that vitamin D can be really helpful. Hydration is another key thing. You're drinking some water right now. That's amazing. Having tea. So water is something that is crucial in terms of how we detoxify. When we are dehydrated, we hold on to toxins in our body. It increases the stress on our body and makes our immune system less powerful. A lot of people, amazingly enough, come into my office and I ask everyone how much they eat, or how much they drink, the quality of their water, and you'd be amazed how many people say, 2-3 glasses a day. And I'm in awe because my body, again, tells me as soon as I'm not having enough, I get that thirst signal. But then I remember that not everybody's body is telling them that right away. And people think that because they're not thirsty, they don't necessarily need the water. You don't feel the dysfunction until it actually manifests as more of a disease state. So staying on top of that hydration with at least half your body weight in ounces of mineral-rich quality water is another key thing. Healthy bowels. Not necessarily something that we commonly talk about in society, but I talk about every day because how your bowels are moving is a fantastic window into the functioning of your system. So sleeping, eating, breathing, walking, pooping, all of those key functions tell us about the state of your health. So bowels, as a primary way that our body detoxifies, need to be working. They also allow us to infer how well are we absorbing. So I have quite a few patients that say, oh, my diet's amazing. I eat my leafy greens. I eat my good quality meats. I get my good fats. And yet when we test them, they are extremely nutrient deficient. So it's not necessary to have a great quality diet. We need the colon and we need digestion from top to bottom to be functioning so you can reap the benefits of those quality foods and then be detoxifying the waste products that your body creates and that you pick up from the environment. So making sure your bowels are moving is important, and supporting your probiotics. So another thing that I see very commonly, even amongst patients that don't have a lot of symptoms, they wouldn't classify themselves as sick or having a disease, the bacterial balance, or I should say imbalance, of their digestive tract is astonishing. As an industrialized society, the diversity of bacterial species that most of us have in our colons compared to those of hunter-gatherer, more primitive societies, is very, very sick. So we are really only as healthy as the diversity of the species in our bodies. So at least with probiotic support, we can help our immune systems a little bit, because our gut is really the center of our immune system. A few more things: movement, sweat, building muscle, again, helping detoxify your body, are all going to be key things to helping protect your body. The next would be some sort of yearly or bi-yearly cleansing, making sure that all your routes of elimination, detoxification are working. It's easy to sort of have things build up and not notice over time, so staying on top of that, whether it's a liver cleanse, a bowel cleanse, something to just make sure detoxification is working, is going to be another key thing. And then checking in with your health provider. I like to see my patients every season, because that way we're staying on top of your health as it changes throughout the season and as your needs change. So before you become symptomatic, we can actually make some tweaks, whether it be to nutrition, hormones, supplements, medications, whatever it is, before that happens, before you become more susceptible to things like the flu. Okay, so getting into natural flu treatments. I know most of you saw that handout. So lifestyle. Lifestyle is foundational. So a lot of the things we just talked about in terms of prevention are going to be helpful in the short term in terms of clearing out a flu as well. So plenty of rest, because essentially your body needs strength to fight a virus. Drinking plenty of water, hot showers to clear that nasal passages, avoiding stressors, because those only make your immune system weaker. Restorative activities and gentle movement. So from a lifestyle perspective, same things as preventing. From a nutrition perspective, slightly different. This is where you're not going to want to put as much burden on your digestive tract. You're going to want to pull back a little bit on how much you're eating, so that basically your immune system has more energy than digestion, which actually takes a lot of work to get all the nutrients from your foods. So, easily digestible foods, a small amount of protein, which we still need for a functioning immune system, garlic, turmeric, and things like soups or broths that are going to be really tonifying, and warm liquids, and of course avoiding your sugary snacks, dairy, especially if you have any sort of congestion or mucousy type process, is going to be really helpful. So you'd be amazed at what nutrition alone can do. And next is nutrients. So nutrients, I like to think of them as cofactors. They're supportive things. So we need nutrients, we need more nutrients the more stress or the more disease state we're under. So it's kind of on a continuum. So particularly for the flu, things that are going to support your immune system. So vitamin C, vitamin D, and your antioxidants, vitamin A and E, are all going to be really important. And then herbs. Herbs have amazing properties in that they can be both immune stimulating, but not be sort of like a bomb going off in your body like antivirals or antibacterials. They have those antimicrobial properties, but because they are a natural compound, nothing in nature is going to be just one pathway. It's very synergistic, but they can be really helpful. At my office, my favorite immune complex is called Bio-Vegetarian. It's on that list as well. It is essentially what I call a spicy horse pill. It is an amazing blend of a strong set of herbs: garlic, cayenne, grapefruit seed extract, so really immune stimulating with all of the nutrients that you need. So I usually recommend my patients take 2 of those tabs every 4 hours, which in a daily dose is going to get you upwards of 20, 30,000 IUs of vitamin A alone, which some people are afraid to take more than 10, but for a short period of time, 7 to 10 days, dosing high really helps your immune system fight more efficiently. And then another way to get nutrients in is intravenously. Who's had an IV before? Yeah. It's a relatively easy process, just going right into the vein, and then you don't have to deal with digestion. You don't have to deal with absorption. You just get the nutrients in a 100% absorbable way so they can go to work for you ASAP. So I like to do that for things like high-dose vitamin C, B vitamins, minerals, even just to hydrate. You know, with the flu, I've had quite a few patients this season that couldn't keep food down, that were just vomiting, that were nauseous. So we just had to get them saline bags just to hydrate their system so they could essentially stay alert and not have their blood pressure bottom out. And ozone as well is a really great antimicrobial and oxygenating gas that can be really stimulating to our immune system and very antimicrobial in a way that's not going to essentially wreak havoc of, again, antibacterials or antivirals. So nutrients are a really important component. And then stress. So this is probably, I think, the biggest factor in what our community has been dealing with, especially since the last article that I read was there were at least 8 deaths already just in our community alone from the flu. So we know it's hit us a lot, and that's because the natural disasters have just wreaked havoc physically, emotionally, psychologically on a lot of us, friends, loved ones from some capacity. And so because of that extra stress, we've needed more help from a nutrient perspective, from a lifestyle perspective, from an emotional perspective, and a lot of people haven't gotten what they need yet. Thankfully, things are starting to turn around. People are starting to be a little more stable. I just had a patient this morning who's finally found a stable home, but she was with her 2 kids wondering where they were going to live. So of course her health markers were a little bit off because her body's under an incredible amount of stress for herself and her children and her husband. And the good news is that under situations like that, I really like to use testing to know exactly what an individual needs so that we can give them the nutrients that they need in a targeted way so that those major stressors don't start to wear down other systems. So in winter, it's easy to, write it off as, oh, this is just a cold flu. This happens sometimes. But when we have these ongoing chronic stressors, if we don't support our bodies and give them what they need, that stress is longer term health. So really knowing what your body needs is key. And then the last thing is really knowing that because of that stress, our nervous system gets really irritated and really agitated, which shuts down our digestion, makes our immune system less strong at fighting viruses. So there are a lot of things that in this community we have access to, like just going for a barefoot walk on the beach can be incredibly calming and soothing to your nervous system and can have an incredible effect on your body's ability to digest and repair. So that's pretty much it in relation to the flu in terms of what to do, both in terms of prevention and for acute. So basically, my mantra here is prevent, recover, and take control of your health and your family's health so that you're as healthy as you can be. So if there are any questions, I'd be more than happy to take those at this time. Nope. Awesome. Well, thank you guys so much. I really appreciate it. If you do have anything, info@Regenerate Health MC is where I can be reached. I really want to be a resource for everybody in the community, specifically the Waldorf School, because I really believe that education is the step that you need to feel empowered with your health. And there are far too many doctors that use more from a fear base to get you to do certain treatments, but I'm really, a big proponent of I want to give you all the information and you decide what's best for yourself.
I have a question. In terms of children and nutrition, what are you seeing as things overall that you would say, if you were going to say like your 5 things that you would really want to see children incorporating in their diet, or things that you see like, oh, this is a trend that I don't agree with, or I do feel good about. Your kind of general impressions right now about kids.
Sure, about kids and a few things. Yeah, I'd say the number one thing for kids to focus on is quality protein sources, because it's so easy to just go from snack to snack of a banana or some graham crackers. The carbohydrates are what make us feel good, make us feel comfortable. You know, I have a cute little 9-year-old boy in my practice, and he was begging his mom for some milk. Mom, when can I have milk? When can I have milk? And I know exactly why he's begging for it, because it activates the opioid receptors in his brain. It makes him feel happy. So that's all he knows is, I feel happy when I eat this. But could it create more mucus? Could it be inflammatory for him? Absolutely. So getting the quality proteins, whether it's from, you know, beef jerky or an egg or some nuts or some collagen protein. You know, you can hide protein in a smoothie.
How do you cod liver oil?
Cod liver oil, not a source of protein, but yeah. Cod liver oil, as long as it's a pure source, can be amazing. You know, as an omega-3 source of a fatty acid, it can be really good in terms of helping with inflammation, helping with lubricating your skin, even potentially emotionally, even with memory because of the DHA in it. So that's, you know, omega-3s in general are one of the basic nutrition lifestyle guidelines that I give most of my patients as ongoing supplements. Pretty much probiotic, vitamin D, and fish oils are the 3 foundational ones that all my patients are on, and from then we build out what they need based off of what's going on.
Okay. So proteins for kids?
Protein, I would say, would be the biggest thing, because they're growing bodies,
right.
So they need that. It's also important to keep their blood sugars balanced, and so a lot of times what I find with kids is they want the treats, the sweets, and parents want to give in to that. But then, you know, from a school perspective, you see the inability to focus, or, you know, hyperactivity. The amount of kids that are diagnosed with ADHD, ADD is astounding these days. And a lot of it, not all of it, can really be balanced through quality nutrition, and protein is really the foundation of that.
Yeah.
So, and you know, above and beyond that, a variety of fruits and vegetables so they can get all their micronutrients. That would be the next thing. And hydration would probably be the next. So often kids are given juices or sodas because, again, they feel great when they have the sugar until they crash. So getting them to enjoy water and understand why it's important to drink. You know, I'm excited and yet also very fearful to be a mother in the years to come, because how do I impart the knowledge to my kids in terms of healthy choices, and how do I start them on a routine where they appreciate feeling good in their bodies when they don't have the maturity to know essentially what exactly is causing what in their bodies. But creating those healthy habits for children, I think, is really key. So then you can mitigate any sort of, you know, train wreck in the teenage years, and really set them up for a solid level of health in their adult years.
Do you mind another
No,
child?
ask away. I am all ears. Yeah.
My little girl is kind of, she doesn't poop every day. And it's like, sometimes we'll get, sorry, the poop talk, but.
Hey,
Well,
I think in this crowd we're hopefully good.
We'll kind of get into a groove, and I feel like,
Yeah.
okay, like we've rounded the corner.
Yeah.
But then it's like, I have the hardest time getting her to be regular.
Yeah.
And I'm very nutrition minded. She doesn't eat a lot of, I mean, she does not eat the standard American diet, let's put it that way. But she's also, she's a quality eater, not a quantity eater. And so I have a hard time maybe giving her enough. And then she also gives up on meals before, unless she's eating at your lunch table, before she's, I think, really like satisfied, or has had enough to kind of like maybe trigger the bowel movement. But what do you have any?
What strategies? Yeah, I mean, in order to have a bowel movement dealing with a child that's, you know, not having consistent ones, there's a lot at play. There's hydration. You know, is she dehydrated? Because that's going to essentially make things harder, not allow bowel movements to happen. Is it a quantity of food issue? Potentially, but with that, you're probably going to see signs of, you know, fatigue or, you know, irritability or something that's going to go along with sort of low calorie type symptoms. If she gets cranky all of a sudden, that will be common. So, you know, watch out for that.
Like one key that I should have added here, I think a lot of it, what I might need is something to kind of force the issue, because I think with her it is like she doesn't want to. She associates like it's not comfortable, and so she will hold it.
Yes.
So what I want is something to tip the scale, so she is like kind of forced into the
bathroom. So, and that's not only a kid thing. I had an adult once tell me, I don't go to the bathroom because it's a waste of time. And I'm not sure what my face looked like at the time, but inside I was blown away how you could be so incredibly out of touch with your body. So I think, the approach that I would first take is education and helping her understand. How old is she?
She's 5.
5.
I've definitely
and making it, a little bit of a game. And there are some great books out there that can make it fun. So that's a good point. If there's a fear of bowel movements or pain with bowel movements or the ickiness of it, so just trying to play with it with her and being with her.
Totally. Like that stuff I feel like I have, but is there, because I would give her some of the Calm.
Mm-hmm. Magnesium.
She won't drink it,
Mm-hmm.
as I was saying, or every time she takes a bath I always put Epsom salts
Mm-hmm.
in there, but
Yeah, so you're speaking to an issue of how to get nutrients into kids when they don't want to take them.
Yeah, and she's not a volume eater, so
Yep.
it's not
Most of the time I recommend powders that get hidden in things like smoothies. Or some applesauce and you stir something in there. Powders generally, when we're talking about magnesium or vitamin C, things like that, they don't have a lot of flavor. So as long as you can hide it in something that has a little bit more flavor.
Is magnesium the number one? Is that what you...
That would help induce a bowel movement. I don't know if that's the cause.
Okay.
So magnesium is going to help facilitate bowels as long as it's at a high enough dose. But that may not be the reason why she's not having bowels. Could that help in the short term? More than likely. But you don't want to have her need to be on that for the long term in order to have that.
What about fiber supplements?
Sure, you could go the route of fiber supplements.
I'm only saying this because Tomei says so.
Yeah.
Yeah.
Yeah, absolutely.
I'm speaking from experience.
Yeah, you can try
I'll input as well.
psyllium. You can try.
But I have a hard time, I do acacia fiber or something
Yep.
like that, because I feel like the psyllium is too hard for me to mask.
Mhm.
But because she doesn't eat enough volume,
Mhm.
I find it very difficult. The acacia fiber is I have success with that, but
Mhm.
she won't drink. I can drink a smoothie out of a cup like this, and
Yeah.
that's the problem. She won't have the volume
Mhm.
to where I can hide something that would be helpful.
Mhm.
We did, which is not, it's not the best, the most natural version I could find, but we did find some fiber gummies, which sometimes we'll use.
Mhm.
Because the same thing, sometimes you need too
Mhm.
much of it. Tamisa eats a lot, so it's not.
Yeah.
But I think same with maybe Isla. She's ever since she was little, this has been an issue. And if you have a stretch of uncomfortable times, or then it hurts, and they have the association, and then
And this has
it's
been with Isla since she was little. She
Exactly.
didn't like it, and
Mhm.
so she'll hold it now, and then she'll have accidents because she's holding. So I know that her body wants to go.
Yeah.
Her body is capable of going, but she is trying to be the boss of it.
Yeah.
Yeah, even though it's not the best thing, the fibers.
Yeah. Sometimes and then maybe she'll have some bouts where it's easier and then be able to work through that fear.
I know, but
Yeah.
see, it's we've had those bouts, and
Yeah.
and then I think we're coming to the other side.
Yeah.
We won't keep it on.
I know. Any other questions?
One last question.
Yeah, go ahead.
How do you feel about dairy for kids and how much they should have, whether it's cheese or cow's milk versus other options?
Sure. I think it kind of depends on the child,
Yeah.
but the biggest thing is the quality of the dairy. Some people constitutionally can handle dairy well, others can't. Sometimes it relates to a lactose intolerance, but that's not the only thing. Could also be a casein issue. Could also be there's some sort of inflammatory issue going on that just makes them more sensitive to the proteins or the sugars in dairy. They could have a digestive issue where they don't make the lactase enzyme because it's actually produced in our colon, so you can have an acquired deficiency. But really, and I had a kid today who actually has autism, and we did some food testing for him, and dairy came up totally fine. So I told the mom, okay, we can do dairy, but it needs to be high quality. You can do some raw milk, you can do some goat's milk, you can do some quality traditionally cultured yogurts. But if we're looking at, manufactured string cheese or Kraft cheese or, just processed nutrient poor, then you're basically getting the frankenfood with the chemicals and no beneficial side of the dairy. So I see a lot of traditional dairy as being potentially helpful. But then again, it has to be hormone-free, RBST-free, all that junk-free. So that's going to be more challenging to get. But if it's a high quality dairy, some kids, I'd say about half, they handle it fine. But pizzas and yogurts and stuff that they're going to get at friends' houses, it's just not going to be high quality.
Yeah, with every, even if you're health minded, you're trying to kind of ride all the fads and keep an eye on like what's.
Yeah. Yeah, I mean, and fats, we went through as a society, the fats are bad, they cause heart disease. Now we're like, fat is the best thing since sliced bread, put it in your coffee. And like anything, some individuals do well with it and some individuals don't. If you have a genetic, mutation that predisposes you to higher cholesterol, you definitely don't want to do high fats, but other people are going to thrive on them. So, kids are just little people. So some of them are going to do well on quality dairy, some of them aren't, but most are not going to do well on low quality dairy. One of the blessings and the curses of being a, robust kid with a strong immune system is you may feel relatively fine until later on you start to have, chronic sinusitis or something like that, and you don't. But, kids, they're developing their immune systems and they're also developing habits. So I think it's a really important time to teach them an awareness of what you put in your body is the quality of how you feel, and that can really help them so much later on. So, awesome.
Profile is probably like knowing yourself and then going from there is helpful.
Absolutely, yeah. I mean, and I have some kids in my office. It's awesome, when I ask them, how do you feel when you eat gluten or dairy? Some of them will be like, I don't eat that. I feel horrible. And to have that awareness is great, and that's in my practice, I get the kids that aren't well, that don't feel good for the most part. So they're going to be the ones that are more triggered. But with things like gluten, like dairy, they're inflammatory in absolutely everybody because it's just physiology. They activate opioid receptors, so they're going to have a bit of an addiction to it, just like sugar. Gluten, dairy, and sugar are the biggest three. So kids left to their own devices, that's all they're going to want to eat because that just makes them feel good for the short term. But so, moderation for those that can handle it, and then just high quality. So
thank you so much.
You're so welcome. Thank you. Thank you. So if you have any other questions, my office is on the Mesa, and feel free to email, give us a call. We've been there this is year